Hello and welcome in Critical Care Research Academy. This is Dr. Kashyap. I am this is our session 2, and today what we're doing is we are sharing our in a small presentation talking about how to ask for a research question. Many of you are already knowledgeable in this attempt to do research capacity building in Africa. I'm pleased to present to you next 15, 20, 30 minutes about how to develop the research question. These are some outlines. What we'll be talking today is roughly listing the main steps of the research process, understanding the importance of the developing a good focus research question, because that will determine your research design. All the time you'll be spending with us, or in future, just talk about the PICO T formats, and then applying the finer criteria. These are synonyms I'll go through with this process as we go through, and then maybe constructing your research hypothesis. Maybe I think you were given instruction that you can come up with your research hypothesis, and then we can actually test them in today's call, today's talk, that I can help you develop those research hypotheses. So as you are listening through this talk, I would like you to think about your one or two research question and see if you can follow on a pen and paper the PICO format, and think about if your research question is with apply the final criteria, and then probably we can design a very preliminary research hypothesis today or afterwards as we go through. So what is research, if we ask this question? And then I'm going to ask you, please keep your chat box ready. Next page, I'm going to ask you, uh, what does this process look like? So research is a systematic process conducted to discover new knowledge. We are looking systematically with the patient data and the literature in many different ways, and then we want to get the knowledge out of it, either from the patient data itself, from the literature review, or anything else through interviews and whatnot. So through survey-based research or qualitative research or systematic review, or from patient data for case control and cohort study design, we are looking at creating this new knowledge. This is the process we have it. So now I want you to write down the chat box. What is this process? Is research is a process? What does it involve in this process? Who can tell me this that how what is involved in a research process? I'm going to take a pause for a second, maybe 10 seconds, and I would like you guys to write down in the chat box, what does this process look like? So your task is to write down a word or sentence in the chat box telling me what are the steps, in your opinion, steps in the research process. So please type it in the chat box. Once I receive 3 messages, I will go forward. So one response is coming back is research is a process of seeking new knowledge, bridging the knowledge gap. Perfect. And what does the process involve? What are the steps? Can you lay out any 1 or 2 steps in the research process? I'm looking for 3 answers, 3 words or 3 sentences. So let's move forward. I think research is a process, and there are other, yes, finding the explanation of seen problem, collect the data, and things like that, right? So research, this process, absolutely great points. Collecting the data, testing hypothesis. So research is a process. It starts with a question generated from our practice or what we read, right? When we say question, it's a problem. Can we identify a problem? Can we ask a question, why that is happening? Or I see a combination of these drugs or these diseases and so on and so forth as well. So good job. You guys are participating really well. So this starts with asking a question, identifying a problem, which we may see in everyday practice, or we might have read about it and that got our attention. And then creating the problem, easiest way to do that is, probably doing a literature search, reading the article on PubMed and Scopus or LinkedIn, also not LinkedIn, or for that matter, Google Scholar, or ResearchGate, any means available to you. When you look at the literature, when you read it, and maybe do a search on the PubMed or things like that, you can determine that things have been done in this particular field, but there's a gap in that particular area, or it has been done somewhere else, but not in Africa or in Asia or in your home country, and you may be able to fill that knowledge gap. So idea is, you want to look at literature, or your own practice, find the literature gap, and you try to answer that particular question. This process, you want that question to be a little bit focused. Like, you can't say, I'm going to study everybody who come to hospital. That's a good way to start, but is it too focused? It is focused at all. I would say no, because you can't practically study the whole patient population in your hospital. So you want to have a little bit of a focus approach as we go through. And having a hypothesis, and we'll talk about it. How does the hypothesis look like? That anytime you're going for a research project, you should have hypothesis in your mind, and you should be able to either prove that hypothesis or disprove that hypothesis. The null or alternate hypothesis concept, we have it as well. The next step would be to develop your study protocol. So after today's talk, idea is that you should be able to think about either during the meeting or afterwards to see what could be your research question or what could be a 1, 2, 3 research question, and we can evaluate it through your mentors to have those research questions, define them into a proper question, proper hypothesis, and then developing a study protocol around it. The idea is to create the protocol is that you are getting clarity in your head. What would be my what will be my research question, my hypothesis, what data points I'll be collecting, what will my outcome look like? I'm following PICO, T criteria and things like that. So it start becoming a more or more of a full-blown research protocol as well. Then data collection, data management, and then data analysis will come as a next step. So we don't have to worry about all these steps as we go through. Just to keep in mind that we will go through in next 15 to 18 months with this process. But today's focus, or now immediate focus, would for you guys to start thinking about a research question from your practice or what you have read, see if we can have the focus question and hypothesis. And once that is finalized, then we can talk about writing and developing the protocol. That's going to be our first few steps. And once we have done, then we talk about data collection and other things as we go through. In the end, we'll talk about how we will be taking out the data has been collected. Let's say the data has been analyzed and interpretation has been done. So creating a 1-page abstract or 6 to 8 pages long manuscript, which will go to a journal, or the abstract can be presented in a national meeting or international meeting if you have resources to go and attend some of these things as well. Okay, so this process will follow through for next 15 to 18 months. It's okay if it takes time to develop a question, but then we'll start making some progress as we go through. Let me know if it is breaking. I can shut down my video. Okay, if you hear some issues, I can shut down my video and try to have it as well. How you do the literature search. There are multiple ways of doing it. You can go on PubMed. The link is right there. If you go into review tutorials or NIH, NLM, and I'm sure they will be sending you the videos too. This YouTube presentation, or they will be a PowerPoint will be sent to you, so you can look at that as well. Or you can just go online and on YouTube and search saying how to do a literature search on PubMed or Google Scholar or Scopus and other places as well. There are tons of literature as well. My opinion is simple way to go to PubMed, create your online free account, and then you can deploy your search criteria right there by using the power of 3. Start putting the patient population you're looking into, use synonyms for that in the OR function, then say and then let's say you're looking for crystalloid or colloid in sepsis literature, then say patient population sepsis, septic shock, or this, or this, or this, and crystalloid or sodium chloride or ringer lactate or whatever it is. Use the function of or and to do your search criteria, and that will give you some ideas around it. Or just put down simple use of crystalloid in cancer patients in sepsis, or sepsis cancer patient in Africa or in Middle East or somewhere else, whatever you want to do it. Put simple terms and see what results are coming out. And if you're happy with those results, then you can keep reading those papers and then go into their references, or you can refine your search as you go through. Now, next question comes is, what is a focused research question? We thought we had the focus already. Why to worry about having a focus question? This comes in a place that you want to make sure that what are the criteria for focus question, because if you don't know what the criteria for focus question, is going to be hard to come up with this. So let's give you this mnemonic called PICO-T, which will help you design a focused research question. P stands for patient population of interest, what you're studying. You can't study the whole hospital, whole city, whole country's population. You have to pick and choose what it could be. And many of you say anesthesia. You can pick and choose the patients who are coming for knee transplant, or patients who are having lower limb surgeries, or patients who are with the sepsis, septic shock, or patient with malaria, or patient with pneumonia. So you define your patient population and say, you know what, I want to study patients with breast cancer, or patients who are coming for obstetric examination. Whatever your areas are, you can pick and then have your patient population. And when you design your questions, when you bring it to mentors during the Critical Care Research Academy meetings, I really want you to talk about what is your patient population. That should be your first thing in your research question as you go through. Now, when we talk about different study designs, clinical trial, case control design, cohort design, usually you are doing a comparison. You have your interest group or intervention group, or you have your comparison and you have your comparison group. So your intervention exposure group or treatment group has to be there. So what this is what you are studying for, that this particular thing, a device, a drug, or education intervention, is it helping patient with something, that whatever your outcome is, and we'll come back to that outcome in the end. Is it helping with that outcome? And compared to what? So you have the patient population. Some people will get this intervention, this treatment, this exposure. Some people will not get that exposure within the same patient population. And that is your comparison group. You may do a quality project. Some people will get exposed to your quality intervention, or maybe it's a quality intervention on residents and fellows or doctors or nurses, and some will not get that exposure. That is your control group. So you have to define very clear in your head that this is my patient population, or this is my subject population, this is my intervention and exposure I'm studying, maybe a drug, maybe a device, maybe an education intervention. That is something you're looking into. Then a comparison group or control group, which who will not get or who did not have that exposure. You identify an outcome of interest. Outcome would be either patient's death, length of stay, cost saving, or satisfaction, or whatever outcome you think that exposure may cause in this patient or the subjects you're looking into, that will give you the effect of that intervention. So PICO. And T is your time required to follow up. If you have done a prospective study which require the outcome will take time to have achieve it, you need to mention that it's 6 months from now, 12 months from now. Or you're doing a retrospective cohort study or case control design, where you might need to a follow up for certain period to get your outcome as well. You have to define it. So either say that you're not looking for time, you're looking for the people at the time of the study, you are looking for outcome to be achieved, or people minimum 3 months of intervention has to be there to get the outcome as well. So PCOT criteria is going to be very, very important. Sometimes T will not make sense for your research question. It's okay for you to avoid it, but still focus on PICO. Make sense? I'll take a pause to see if you have any questions or something is not clear to you. Give me a thumbs up sign. Perfect. Good. Thank you, Aisha. Or somebody else. Or ask questions in the chat box as well. We'll take a process as well. Now, this comes with your idea of sharing your research question format. So by now, I really want you guys to write down in your Word document or on a paper what could be your PICO question. And once we can go through very quickly in the end, once I finish the slides, and we can probably stop the recording at the time as well. Once you start formatting your questions in PICO part, now I can give you another mnemonic to see how you can be informed about creating those questions. What would be the feasible question? This was a focused part of it, how you can have a focused research question. If I create a feasibility part, it's going to be a finer criteria for feasibility part of it. As you're thinking your PICO question, you want to start thinking that it's going to be feasible, it should be interesting, it should be kind of novel, ethical, and of course relevant in today's age and era as well. So thinking of feasible, interesting, novel, ethical, and relevant. And let's think about feasible. If you're planning a study which will require enrollment of patients, and you can only enroll 10 patients in a year, remembering we only do 18 months of time period, you may not be able to receive 100 patients if you're doing a prospective study. Or if you're thinking of a study, we'll come back into sample size calculation and other things, and then it requires you to enroll 1,000 patients. and in your hospital you only see 200 patients a year like that in the retrospective study, then probably it might not be feasible. So you have to think about the design question I'm doing it. Would I have enough number of patients I see from retrospective data or from data from one hospital on paper charts? Or if you have electronic medical records, maybe you might have to collaborate with other people in the group or within your hospital or nearby cities, so they can collect the data for you to have make it more feasible in terms of the time and affordability. Now, do you have enough technical expertise? If you are practicing in anesthesia and you're trying to do something in ENT, which is not your expertise, so that is something you have to think about it, that this is within my subject areas, or do I have enough expertise from my mentors and other places? You don't want to ask a boring question. You want to ask something interesting to you, to your team members, and then this might be something more relevant to add in today's day and age and era. Like malaria vaccine is coming out, something around it, maybe survey around it, maybe a survey among your colleagues who know are interested in this thing, COVID-19 or Zika virus or anything else which is important and pertinent to you, interested to you. Asking that question is a good idea. Uh, yes, these questions you can always ask, speak out. You can ask for cross-section studies as well. Outcome may not be the listed there, but you might have a comparison group, or you may not have a comparison group. You just have intervention group and outcome. You're looking for saying you're not comparing with anybody else. Within the cross-section studies, you can find out the people with more experience compared to less experienced people speaking English or French or Spanish may have a different version. So you can always find a comparison in your cross-section studies too as well, that you don't have to, but there are opportunities for asking those comparison in cross-section. And we can maybe discuss that thing at the end of the talk. You want to design a study which is ethical. Idea is that you don't want to do something like, if you know this thing is helpful for the people, then why to have a control group? You can probably design two different arms rather than a group get. Maybe crossover design might be a better approach. Or maybe the study example is parachute saves life. You don't have to randomize people to have them jump from the plane with and without parachute. This is not ethical. The people who with the parachute jump, they will with the parachute who jump, they survive more or all the times compared to people who don't jump with the parachute. So think in that regard that when you design the studies, those studies has to be ethical, and then they should be able to approve by IRB as well. So now, goal is that what you were already thinking since I started talking about your PICO question, and see if yes, this will be a feasible study. Is it interesting enough? So make sure that you have check in your brain, or maybe you can list down that into a Word document you might be able to share in the end with this part, that making sure that you are applying these final criteria to your research question. I'll take a pause for a second and then see if you can apply these criterias. I will jump now onto research hypothesis part of it, and I'll give you some example. So once you start defining your research question, then there should be a hypothesis in your mind that this hypothesis is designed to answer your research question. Is people with smoking develop lung cancer? I'm just giving a basic example. Your question is, that is your question you're trying to answer. That's why you design the hypothesis. So your hypothesis is a statement which specifies this relationship between these two variables. Smoking is your exposure variable, lung cancer is your outcome variable. If smoking is your exposure, lung cancer is outcome. Remember, we talked about PICO, so this is your intervention or exposure of I or E. So this hypothesis is establishing that relationship. It's specifying that relationship between those two defined population. Okay, and that is between the defined population. So you're talking about the patients coming to your pulmonary clinic, a patient coming to the church, patient coming to whatever, a mosque for that matter is, and then saying how many of them smoke compared to who don't smoke, and then how many of them they develop lung cancer in last 20 years or something like that. That's a very simple example. Now let's give you another example. It may or may not be pertinent to your practice. So my research question is cancer in cancer patient, that's patient population P, with septic shock, what is the effectiveness of low dose hydrocortisone? Okay, this question includes your P, it includes your I, includes your outcome. C is not there, but we can talk about it. So now I want you to think as you're following through this lecture and writing in your Word document, or most likely typing it, because I would like you to share your screen in the end, or at least copy paste it here, where we are formulating the research question, applying PICO, final criteria, and now hypothesis. So I really want you guys to start looking into formulating hypothesis. My hypothesis is that low dose hydrocortisone is effective in cancer patients with septic shock compared to high dose hydrocortisone, or compared to no hydrocortisone. You can define in any ways as a comparison group in this regard. So think about your research question and think about your hypothesis. That, my hypothesis would be to ask a question about uh, if it is helpful, and then your hypothesis is it is effective compared to no hydrocortisone or high dose hydrocortisone and things like that. So let's take a 10-second pause to see if you can start formulating your hypothesis. So I'll bring up these slides again. Go ahead.
Yes, so I it's going to look somehow.
Yeah, thank you so much for that question. Now this is my last summary slide, and we'll turn on our videos and maybe discuss our research questions. So what we talked today is that research is important. You all are here. I'm so glad you are here, and it's an absolute opportunity to share what I know a little bit and learn from you all as well. So it will definitely help us advance patient care and decision making. It's a systematic approach. So far, you don't know where to start. You came up with this idea, or maybe you were thinking, I don't know where to start. I have some research question. Now, at least you know that there's a process if I follow, and if I follow this 6, 7, 8 step process in next 15 to 18 months, I will be able to answer one research question in this regard. This PICO T, and final criteria would help you develop a focused research question, a relevant research question. And then you should be able to generate an hypothesis. As Fatwami has shared about that, she has a hypothesis. If she look for this intervention, can she answer the question if it's helpful or not? This exposure in her patient population, is it helping patient or not, for that matter? So with those words, we will stop the recording today, at least in my part, and then take the question and maybe review some of these research questions or research hypotheses you have today. Please watch the video. There's a lot of information here again, and then we'll be able to share that with you.